Okay, now that we have done the weaning, it is time for extubation. My patient has an appropriate crop score of greater than 13, and my patient has an RSBI that is lower than 105. So now I have gotten my extubation order from my doctor. I'm going to check the chart first to make sure that the extubation order is in the chart. I'm going to wash my hands. Alright, I got my hand wash on, and I'm going to put my gloves on, and then I'm going to enter the patient's room, and I'm going to say, "Hey, Mr. Smith, it's Taylor from respiratory again. Are you ready to get your tube out?" And he shakes and says yes, because he is awake and alert and conscious. His sedation has been weaned down. So once I have told him what we're going to do, so we're going to take the tube out. We're just going to, I'm going to take all this tape and stuff off of your nose. We're going to set you up on some oxygen to go actually in your nose, and then we will take the tube out. So before I do that, I need to do my cuff leak test. So I'm just going to connect my cuff manometer to my cuff, and I'm going to make sure that my cuff leak is greater than 15%, and I'm going to put that away. And I can also do the cuff leak test with deflating the cuff with a 10 ml syringe and listening for air movement around the cuff. So I'm going to do that now. You just place your stethoscope that right there. Do that. Alright, deflate the cuff. And I heard air movement, so that's perfect. We want our cuff leak to be greater than 15%. So once I have all of that set up, I'm going to go ahead and set my oxygen up for after extubation, just to make sure that my patient has oxygen. Right now he's on 30% FiO2 on the ventilator, so I'm probably going to put him on like 4 liters. And you want to do the humidifier. So set to 4 liters. You want to do the humidifier just because they have humidity coming from the ventilator. Keep them nice and moist. Once I have set my oxygen up, I want to make sure that my suction is set up. We want to suction the patient's mouth, and if they have the subglottic suction, you also want to suction that to make sure that the secretions don't fall below the cuff after extubation, which could cause pneumonia. So my suction is set from 100 to 120. I'm going to make sure that it works. Take it off of this. Works. And before we extubate, you always want to use the inline suction and suction any secretions down and deep in the lungs. I also have my yank hour with me to suction the patient's mouth. You want to do that before too. Make sure that Mr. Smith can go each side of the mouth. Very good, very good, very good. I'm just going to keep this set up since we've already suctioned deep down. Also, always have an ambu bag in case anything goes wrong. And then I have my chucks pad. Chucks pads just to make sure that the patient doesn't get dirty. Alright, and before we do this, we're going to listen to some breath sounds, make sure my patient's vitals are still good, everything still looks good from where we did the weaning assessment, so he's good. Just want to double check. Perfect, perfect, perfect. So now we're going to do this. And since my patient is spontaneously breathing by himself, once I unhook the strap, I can go ahead and take this off just in case he has any kind of droplet thing going on. It doesn't blow anywhere on me. So I'm going to say, "Okay, Mr. Smith, I'm now going to unhook your ties off of your face. I'm going to keep a hand on your tube so it doesn't go anywhere." And then trash that. And then I unhook my vent and it is on standby. I'm going to grab my 10 ml syringe and say, "Okay, Mr. Smith, I need you to take a deep breath in, and once the tube is out of your mouth, I need you to cough all those secretions up." He says, "Okay." So I'm just going to deflate my cuff and then pull the tube out. Cough, 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 cough. And he coughs up all of his secretions. Suctions his mouth. I'm going to suction all of his mouth. Tell him to make sure he can cough. Ask him what his name is. Make sure he knows where he is. All the things. I'm going to say, Okay, Mr. Smith, you might want to not talk as much. Your throat's gonna be a little sore. Don't eat anything for a little bit just to make sure that everything's okay. I'm gonna ask if there's anything that he might need. I don't think there is. Trash all of this. And then I would clean my vent, make sure that's all taken care of, and let him know that he has suction right beside him, so if he coughs anything up, he needs to suction it out of his mouth and do not swallow it. I'm gonna stay around for a few minutes, make sure all of his vitals stay in the right range, make sure that he doesn't become agitated or anything like that. And once I've stayed around for about 30 minutes or so, I'm gonna go and chart everything I did, let the doctor know that he is extubated, and continue to check on him every so often.